When we think about maternal health, we think about something we are expecting. When we're expecting a baby, we expect health, we expect happiness and longevity. But we oftentimes don't think about the adverse effects or the challenges that may arise from carrying a child. That is what we think about too when we talk about maternal health.
Heart health is essential. We need moms to be healthy in order to have a healthy baby, and all of that connects to the placenta. So having a nice, strong heart that is pumping all the blood to all the adequate places gives us a healthy baby.
Hypertension is the leading cause of death amongst women and birthing persons. Not only is it an issue during pregnancy, but also during the postpartum and later in life.
We know that when you have hypertension or high blood pressure, it increases your risk for a heart attack, increases your risk for heart failure, but also goes to all the other organs. So it affects your kidneys, it can affect your head. When it becomes severe, greater than 160 for the top number or 180, it can lead to stroke. And it also increases your risk for preeclampsia. You can get preeclampsia in pregnancy, but also postpartum. So a lot of people don't know that they're still at risk, and in those first 2 weeks when you're at your highest risk.
Pregnancy puts a really hard workload on a person's body. So for us here, it's something that we are really adamant about addressing and most definitely working to eradicate.
With high blood pressure, sometimes it can be the silent killer. And as women, a lot of times we put others before us. So we're gonna ignore that headache and ignore everything else.
According to some state-level data, approximately 64% of pregnancy-related deaths are directly related to hypertension. It's manageable, it's treatable, and with appropriate care, we can have an impact on those hypertension-related deaths.
When we think about disparities in maternal health, unfortunately, Black and brown women have almost a 3 times higher rate of having a maternal mortality, which is a death, or even a bad outcome in pregnancy.
When we talk about things like social determinants, we're talking about nutrition security, transportation and housing,
Systemic policies and structures that was in place, but also unconscious bias and implicit and explicit bias.
We're talking about all the things that may impact and affect physical well-being. So in Detroit, we're really working collaboratively with our clinical partners as well as with community-based organizations to really address maternal mortality and morbidity. We have an evidence-based program known as Target BP, and it's a great opportunity for us to clinically address and support our partners. In addition to that, what's needed is coverage for blood pressure monitors and what we call SMBP, self-measuring of blood pressure, because having the device is putting the tool in someone's hand along with the education and the skills to take one's own blood pressure so that you can act immediately when it's necessary.
It can't just be that physician in the middle doing everything. We have to be open to partner and communicate, collaborate with our community partners, our social workers, our case management, because if you seek care early, we can have great outcomes.
And we want to come together to have conversation, have discourse, and of course, put a spotlight on the challenges as well as the joys that come with giving birth to a child.
So as a community, I think it takes a village. Maternal health is everyone's health. We all came from a uterus, and it has to be at the top and a priority.